how is it going with the Change Healthcare thing? Have you been getting a lot of calls?
I fortunately haven't been getting the calls on it. Our regulatory compliance has been getting some of the calls on it. So
Yeah.
they're looking at the data breach and data breach coverage and things like that. I've gotten a few calls on it. More so, they're upset that our state dental plan, the Medi-Cal dental, doesn't have a checks and balance in place for this one. So there's some upset providers out there for that. But yeah, that
Yeah.
was a huge shakeup, and it was across all social media. I'm sure you saw it. I saw your video, your podcast that you did not too long ago regarding it was,
Yeah.
right off the very first, a couple of days after it had happened. So yeah, it was a huge shakeup, a huge shakeup.
So is Medi-Cal back to paying? That is cash flow going now? Because they were
They're
using Change for claims and payments, right?
yeah, they're
Yeah.
working on it. They're working on it. So we have some of in our public policy that's reaching out to them and trying to work through some of those kinks. But
Yeah. A friend of mine owns a small medical billing company. She only works with doctors, medical
mhm.
doctors. And she said something like 80% of her clients were strictly Change. And
Mm.
they're all like looking for short-term loans, and her company even, because they don't get paid if
Oh
nothing's
gosh,
going.
yeah,
So
yeah.
she was looking for a short-term loan for her business. So this is just such a huge
It was a
trickle down all
huge,
over.
yeah,
Yeah.
yeah,
So all,
absolutely,
and
yeah,
even the dental billers that do it, have a third party service. They're like, well, we're not getting paid either. So it's
yeah.
just all over the place. But yeah, I think the Medi-Cal providers have a point, though. I think that's something that our industry has to look at. Like, these exclusive agreements are
hmm
not helpful when something
Yeah.
like this happens. And I'm not saying that they tried to mislead us, because who knows what was going on. And I wouldn't ever want to be in their shoes. But for Change to say there was no breach at the provider level, it was very premature, I thought, for them to say that. You don't know. You don't know what
Sure.
breaches are to come. I don't even think we've started that investigation is going to start now. Like, now we're going to hear about all these things.
Yeah.
So when they're calling your offices, are they worried about their exposure to the breach?
Yeah, that's why the regulatory compliance, that's why my colleagues over in regulatory compliance are getting those calls based off of that, is that they're concerned about how has any of their information been compromised.
Yeah. Well,
Yeah.
and I know Office of Civil Rights just said that they're not going after providers for that because, I guess kind
It
of.
was outside of their hands really at that point. Yeah.
Yeah,
Yeah.
but at some point, I mean, if you do determine you have a breach, though, that does, like, OCR is not coming
There's
after you. But if you have a breach, you still got to follow the rules.
there's so much work that goes into a breach. There's so much work that goes into it. Yeah. Yeah.
Yeah, like HIPAA officers, my hat's off to you, because I don't want to do it.
Really.
Cybersecurity
Yeah.
people, I don't want to do
Yeah.
it. Yeah. So
Yeah.
thank
Yeah.
God there's experts out there. And then when they got the call, I got the call to the interviews. I said, only as it pertains to dental claims. Don't ask me anything about
Yeah.
viruses or anything. I
Exactly.
don't know anything about it. So,
Yeah.
so hopefully we come out okay. But I think it is important
With a
for us to
safety net
have
in place,
choice.
hopefully. Yeah. We hopefully
Yeah.
come out okay with a safety net in place. Yeah.
Well, and that goes back to, I mean, you're part of the whole practice management department there. I mean, is that something you guys go into when you're teaching basic business, is to have sort of a cushion of cash reserves in order to kind of mitigate these types of things?
I mean, not necessarily to mitigate that, but just in general to have some sort of a reserve there in place for who knows what could come up of different things. It's also like, your personal savings. How much can I have, and especially with how offices have been impacted since the pandemic as far as cash flow coming in, it's not
I'm
always
sure.
easy to have that reserve sitting there that you had 3 years ago, 5 years ago. So
Would you like to hear more? Follow the link for the full episode.